Hi, everyone. Welcome to Nap Time Nutrition. I am Yaffi Lvova, registered dietitian nutritionist with Baby Blue Nutrition. And today with me is the fantastic Dr. Robyn Wilhelm, PT, DPT, and we're going to be talking about sex. Thank you so much for having me, Robyn.
Oh, you're welcome. Thanks for having me.
So first, I want to say how this actually started. Well, I've known Robyn for a while, and I know she can't say this, but I can. I was a patient, and so I can say from firsthand experience as well as professional knowledge that Robyn's awesome and it's a really welcoming environment in her office, and it's that kind of place that you just want to escape to and go have a cup of coffee with like no kids around. But so the whole subject came up about a week and a half ago when I was talking to Candace of the Amused Mama podcast, and hopefully you'll be seeing something fun from that come out soon. But she asked me if there were any subjects that were off limits, and I said, well, my sex life. And it started this whole conversation, and so now here we are talking about maybe not my sex life, but
right.
But talking about sex. So Robyn, you see a lot of problems with sex after baby. What do you want to start with?
I do, and kind of can be for varying different reasons. So I think maybe, I do get some women that tend to say, I thought they expected it would be painful potentially the first time after having babies, so the very first time, but they didn't realize that it could continue to be uncomfortable, and then they're not even sure where to start or what the issue is or what's caused it. So I think I try to, especially if I'm talking to a large group and I'm starting out with some of the basics, if you will, I try to remind people that vaginal birth, it entails a huge stretch of the pelvic floor muscles. So you're talking about potential kind of micro tears, micro injury to your pelvic floor muscles, the vaginal canal. And then oftentimes we kind of forget, but that also includes a stretching and potential injury even to what we refer to as the vulvar area, which is like the lips of the vagina, so the labia minora and majora. And so I think we just kind of tend to, I don't think we forget, but in the scheme of things postpartum, when you're taking care of a new baby and you've got a lot on your plate, we're just not thinking in such specific terms about our bodies. So keeping that in mind, that a vaginal delivery, and if you really think back to it, and then some people may have perineal tears that affect the area, or maybe they've had an episiotomy. So taking into account how much that area really needs to heal, and hopefully heal pretty well. Unfortunately, painful intercourse can be a side effect of some things going on during the healing process that maybe we don't always even realize. So there's two main categories. You can either have some tightness in the area, like hyper irritation of the area, or you can be in the other category where you actually have a laxity and a decreased strength of the pelvic floor. And either one of those two things, for various reasons, can make intercourse less pleasurable and actually even to the point of painful.
Right, and so you brought up certain things that are specific to vaginal deliveries, but even with C-sections, we see a lot of pelvic floor issues that maybe are not even anticipated because we associate it more with vaginal deliveries. So it can be a real surprise to someone who's delivered by C-section to be seeing some of these same type of issues.
Oh, yes. And I do hear that a lot, because I'll hear women that come in and they're having painful intercourse or possibly urinary incontinence, and they'll say, I didn't think I would really experience any of this because I ended up having to have a cesarean. But I remind moms that, for one, we're all pregnant, give or take 9 months, so we're dealing with the pressure of the growing baby, growing uterus, the pressure coming down into the pelvic area, pelvic cavity. And then also, some individuals do have a planned C-section, or they don't have very long of a labor until they go in for a cesarean, but then some mothers labor quite some time before they go in for a cesarean. So, you're seeing some moms that really go through quite a pushing phase, if you will, and then it's determined that the cesarean is going to be done. So still definitely on the lines of risk for having painful intercourse.
Yeah. It's very interesting. So what should someone do if she's recently had a baby by either method of delivery, or it comes out her ear, or what have you?
Right.
What's the first step that someone should take if there's a lot of painful intercourse?
Yes.
Well, okay, intercourse with a lot of pain. I didn't mean a lot of, anyway.
No, I know what you meant. And if it's okay, because I know what you're asking, which is an awesome question, but I'll backtrack just a tad, almost in a preventative way. You know, unfortunately, you and I have discussed and stuff our desire for postpartum care in the United States to just be better and more plentiful and more knowledgeable for women. So in regards to that, a lot of women don't necessarily get any information on, here are some tips to take care of that area, you know, the vulvar area, the perineum area. So we do oftentimes get the peri bottles, you know, the nice bottles that we can squeeze the warm water on after we're using the restroom. That's something that I encourage every new mom to use. Again, even with individuals who have had a cesarean, they can still have quite a bit of swelling and discomfort down in the vaginal area. So I tell them to kind of consider it the same. I give these guidelines no matter mode of delivery, so to speak. So definitely using that peri bottle. The big thing is that we want to try to allow the perineum and the vagina and you know, even the vulvar area to heal as best as possible, because then hopefully you're preventing some of the possible, you know, not so great things that can occur that lead to painful intercourse. So using that peri bottle, keeping that area as clean as possible, but I tell moms, don't scrub the area, don't be real vigorous with it. It's very delicate tissue. Our vaginas have a natural cleansing type of system. So after birth, sometimes women are a little concerned about any kind of discharge that is coming out. How does it smell? How does it look? That type of thing. Oftentimes that's just the vagina itself really kind of self-cleaning. You know, it's the body's taking care of itself after birth of baby. So definitely cleaning is important. Just no scrubbing, you know, no harsh soaps, things like that. I encourage all my mamas to wear either loose fitting clothing, cotton underwear, something that's very breathable to the skin. I also encourage them that if they're sitting in different positions for breastfeeding, for just, you know, maybe they're trying to get out of the bed for a little bit and they just want to sit up, I'll often encourage them to take 2 pillows and place a pillow under each thigh area, like where your sit bones are, so that then when you're sitting, the perineum area is allowed to just kind of relax in between that space there. You know, it just kind of can be free, and so it's not compressed against a surface all the time. So those are just a couple tips, but I just wanted to mention those, if you don't mind, because it's kind of you know, it's preventative. It kind of helps you maybe hopefully allow the perineum to heal and maybe avoid some of the painful intercourse.
Right. Well, really good tips.
Yeah. But for after, you know, say they've gotten to a point where they have intercourse the first time, it's not uncommon for it to be different. It may feel different. It may feel uncomfortable. It may even feel a bit painful the first time. Oftentimes that depends on positions and everything of that nature too. So that makes a difference. But what I encourage moms to do if they have continual discomfort is, one, definitely check in with midwife or OB. You should not necessarily be having painful intercourse 6 to 8 weeks out from healing postpartum, especially if you've attempted a couple times. You know, if you're having your first experience 8 weeks out and it's painful, that's a little normal. That's your first time. You know, I'm trying that again. But if it's your, you know, 5th time and you're 10 weeks out or whatever the case may be and it's still painful, it would definitely be something I would bring up with your provider. Seeing a pelvic PT directly is you're able to do that. You don't have to have a physician referral. But in regards to at home, really, I always encourage moms, take a mirror, look down in the area. Don't be afraid to do that, because you want to look for, maybe you have areas of redness. If you had a perineal tear and you had stitching, maybe by looking you can see whether or not, is my skin still red and irritated? Does it seem okay? You know, what's going on with the tissue itself. Another kind of tip that's helpful is beginning to, especially if you have or if you notice pain with initial penetration with intercourse, doing a little bit of a perineal massage. Most people are going to be very careful with themselves. Most people are not going to go into the perineum area too hard because they're just being cautious, which is good. But for women, you can do it in the shower because we have the water naturally there, so that's kind of nice. You can do it semi-reclining in bed with a little bit of lubricant, and you just can place your thumb or 1 to 2 fingers in the perineal area and test out that tissue right there. So move the tissue up and down gently. Does it feel tight? You know, is it kind of ouchy to do that? And then move it side to side and kind of just detect the same thing. If it is, that's a good thing to do on a daily basis to try to get that tissue to relax, because that sometimes has a lot to do with painful intercourse. Mm-hmm. If it's more internal, so meaning like people will say, I don't have any trouble with initial penetration, but the deeper penetration, that's what really causes me discomfort. That could be muscle tension or tightness. So sometimes some relaxation exercises, anything honestly from, I've had people be greatly helped by beginning a meditation program where they're trying to relax their body. They've gotten back into doing more stretching, more mindfulness connection, and that really helps sometimes to take a nervous system that's a little hyper in that area, if you will, and help to calm it down so that your body recognizes that that's a safe place. I'm okay to relax in that area. That's really made a big difference for some people. So that would be an initial thing you could try at home for sure.
And that's not to say that your problem is mental. That's to say that you're using mental feedback in order to relax the body.
Yes, yeah.
So I just wanted to jump in and add that.
Yeah, no, that's good, because I do have women coming to me a lot who may have already talked to a provider, and unfortunately it wasn't very helpful. And the information is, have a glass of wine, try to relax. Well, we don't want to necessarily encourage that because that could be, starting a bad habit for someone, but it also makes them feel like they're not as in control of it, So there's certain things that you can help your body with to allow your neuromuscular system to realize that I'm safe. Let me try to relax my, muscles, relax my pelvic floor. There's some nice pelvic floor relaxation exercises oftentimes that you can do, which really focuses on the inhale of your breath and to really try to connect with feeling down around the pelvic floor. And when you take a nice inhale, you really want to sense that you're allowing the pelvic floor and you're allowing the vaginal area to just open and relax. And, they're breathing exercises. So they are, they're affecting the nervous system. And so sometimes it seems like, oh, is that all mental stuff, I should be doing? Not necessarily. It's just connected into your body, like you said.
Right.
And yoga, they have a nice position called Happy Baby. Happy Baby position. Happy Baby position is actually a really good pelvic floor stretch. So I tell people, get in that position, stay kind of relaxed, just make sure you're not holding a lot of tension in the body, and do a nice 30 to 60 second stretch. That can be really helpful for individuals if they're suspecting that they might have pelvic floor tension.
I'm looking up a picture of Happy Baby pose so that I can put it on.
Yeah, it's a good one. A lot of people don't know that it's actually a really nice position for the pelvic floor in regards to kind of opening and stretching a little bit, because you just don't you don't feel it as much as, say, like an obvious hamstring stretch that you do or something. It's just not as obvious.
Right. So I hope this pose is showing up. You're laying on your back, you're holding the side of your feet with your knees coming back toward your armpits, and you pull back a little bit on your feet at the same time as you're pushing a little bit with your feet, and that's relaxing that whole pelvic area. Yeah.
And I know in yoga, for anyone out there listening that has been in a yoga class and maybe they had very specific instructions on how to do the Happy Baby pose. Yeah, there it is. in regards to kind of relaxing the pelvis and relaxing the pelvic floor, you definitely get in the position and then just allow the body to relax. I think sometimes in yoga we use some counter pressure as well. But in the case for pelvic floor, that is an excellent stretch to just kind of hang out in for 30 to 60 seconds and let the stretch kind of do its magic a little bit.
Mm-hmm. I think that's great. That's one of my favorite poses.
Yeah. I mean, I don't, you know, I have people that don't necessarily have painful intercourse, but they do that stretch daily and kind of balance that out with some of their pelvic floor exercises that they do. And it's just a really nice position to relax in, really.
Yeah. So you brought up something that I really want to address, that if you're having trouble, you should talk to your OB about it. Mm-hmm. But we also need to keep in mind that a lot of times, I know I can say this as a dietitian, sometimes it's difficult for doctors to refer out. And sometimes doctors don't necessarily understand the importance of the pelvic floor. I know that certain recommendations have been made for expensive kits to help with dilating, and maybe inappropriate recommendations about the vegetable aisle at the supermarket. Right. And I'm not making that up. So.
No, I know.
Someone anonymous sent that one in. So it's important to know that there are people specializing in this. And if you're in the Phoenix area, you should definitely contact Robyn. But if you're wherever you are, there should be a resource for a pelvic floor specialist physical therapist.
Yes, it's a really excellent point. As you know, pelvic PTs, we're what you call a doctoring profession, which basically just means that we're all, you know, any school that you go to now, it's a doctorate level, right? That means we can see, I believe in all states now, it's law and regulation that we can see patients directly. So we are trained to be I guess cautious in the sense of making sure that if we feel like someone needs to talk to their doctor and it's beyond our scope of practice, we are trained to make sure that we encourage those people to go back. And we are also encouraged that we sometimes will tell people, you know, well, kind of check in with these symptoms with your OB or your midwife. They're the ones that, you know, helped you through having baby. But for some people, they just don't get the greatest answers, or and another thing to kind of keep in mind is you're right on point, because many of the midwives and OBs, their clinical practice on a daily basis is really geared towards the reproductive side of it, right? So oftentimes, sometimes after the woman has a baby and then is having some difficulties afterwards, they're not as well trained on some of that. And I've talked to some midwives and OBs, and I was just actually on a webinar last night with a urogynecologist, and a urogynecologist even kind of said the same thing. We were talking about prolapse, so it was something a little different, but you know, urogynecologists are very trained in prolapse because they literally see it almost every day of their practice, right? Mm-hmm. And OBs and midwives don't see it as much. Just like sometimes they don't do pelvic floor exams like we do. It's not typically as thorough. Usually they're in for the testing to like test for, you know, doing pap tests, or they're in palpating prior to pregnancy or kind of right after. But most of my reports, even from patients, have been that they haven't had too much of a check, like even at the 4 to 6 weeks. It's just kind of a, hey, how are you feeling? I was actually shocked. One of my patients said today that she didn't get checked vaginally at all. Wow. They did ask, obviously, you know, how are you doing? Do you have any concerns? And she said, yeah, they just didn't check at all. And I thought that they would be checking, you know, that would be part of it. So it was really interesting to me, because I think I was under the assumption a bit too that there was always at least a visual check of some sort, but maybe not.
Yeah. So, and I think it's especially difficult because the healthcare practitioner needs to be very proactive. This is a really uncomfortable subject to bring up. Yeah. And, you know, a lot of us, even as boisterous as we can be in our daily lives, are going to be a little bit timid when it comes to the subject of sex, which is why a few of us have kind of made it our mission to be loud about it lately.
Yeah.
And we need to take back our bodies. And if there's something that's uncomfortable, you need to be able to talk to your doctor about it. And if you can't
Yes.
talk to your doctor, you need to find a doctor you can talk to.
Yeah.
Because we have to feel comfortable with our healthcare practitioners. We have to be able to say the weird stuff that's going on in our head, because it could really be a problem.
Yeah.
And I want to back up a minute as well, because we talked about the muscular and the physical on the outside of in the vulvar area and the vagina, but there are also a lot of bones involved and a lot of cartilage that shifts around during carrying a baby and delivery, and this stuff can get out of joint. I know this is not about the pelvic floor, but after I carried my twins, I had the worst time breastfeeding. And I was in touch with a lot of great people. And it turned out that there was actually a chiropractic issue in my upper spine from the delivery that caused a pinched nerve that affected my nipples. And that was unbelievably painful. And nobody knew what it was.
Yeah.
And so these bones move around and
they
respond to the changes in our body. And sometimes that can also provide sexual discomfort after a baby.
Yeah, no, it's absolutely correct, because there is actually quite a connection between even the diaphragm, kind of mid-thoracic area, if you will. There's actually a ligament that comes off of the fascia of the diaphragm, and it runs down the front of our spine, comes into the pelvic cavity, and begins to spread out again, if you will, kind of flash out into the pelvic floor muscles.
Mm-hmm.
So there's actually a very direct connection. But then obviously just all the other muscles and attachments there, all the ligaments, during vaginal birth, not so much with cesarean, this point, but definitely vaginal birth. It's not just about the muscles stretching. You have ligament stretching, you have nerves that can actually get stretched. So then following birth, sometimes some of the pain that people are feeling, whether it be during intercourse or at any time really, if it's very sustained and it's there even 6 to 8 weeks after birth, it could be a nerve issue too, to where fascia and tissue around the nerve is really still irritating it. So there's a lot of things moving and so much that goes on that I'm just shocked that we don't, that not everyone at least has one thorough assessment after birth.
Yeah. I think a simple "have you had intercourse" would be a fantastic opening for these post-birth conversations. We all go back for multiple checkups after having a baby.
Yeah.
So we're there. I would love it. I think we should send out a PSA to all of these OBs and say, please ask your patients if they've had sex, because you need to have this conversation. That's really important. It's not just for physical pleasure. It's for connection within your relationship. It's for regaining your sense of self when your identity has changed, when everything around you has changed. It needs to be available as an outlet. And if there is something stopping you from connecting with your partner, connecting with yourself on this level, we need to feel comfortable to talk to our healthcare practitioners about it. We need to take care of it because, as you said, some amount is normal and expected. And then there are plenty of people experiencing something beyond that do need some assistance.
Oh yeah, most definitely. And I think you raise a very good point. And I will say, I'll preface what I'm going to say with the fact that I feel like I'm blessed to know quite a few people that are kind of getting all these conversations, right? And so they are asking more. But if you really look at the overall spectrum in our culture, just say even in the United States, I mean, not always just locally, but just in the United States, we are still kind of skewed on our thinking of sexual health big time. So you're right. It's not necessarily just about pleasure, but it's about connection. It's about how a woman feels after she's given birth, because the identity of being, especially, with your first birth, but I think it can really constitute any birth, but how you feel as this new mother versus in your sexuality anyway, how you feel as a mother being sexual versus how you felt when you were a non-mother being sexual. So all of that stuff kind of comes into play, and then you have to go in and potentially talk to somebody about it, and then if the answer is kind of like, I'll tell you what, one of my answers was from my OB at the time was like, well, you do have small kids, so you're probably just really stressed. It's kind of normal. Though I appreciated that they were acknowledging that stress can be a part of things, right? And the big picture, I didn't feel very heard otherwise, because I am a healthcare professional. So I probably waited to report what was going on with me because I knew all the, the things that could be contributing, like I'm stressed out, or I'm just, so I didn't feel very heard. And I think that's what's happening to a lot of people. I saw someone say this, and I wish I could quote the person. I just can't think of who it was. But they said, it's not necessarily that people don't have stories to tell. It's that they're not being asked. And and it is kind of, those appointments are short. Most of them are very short, right? And so that's a very touchy subject to bring up if you feel like you're going to be rushed an answer in 2 minutes and then scooted out the door.
Yeah. And we tend to blame ourselves.
Yeah.
We have this tendency, you just become a mother. And so birth is hard. Okay. The end of the pregnancy is hard. You can't sleep.
Yeah.
Maybe the whole pregnancy is hard. You have having trouble sleeping. Maybe you have nausea. Maybe, that becoming pregnant is like the start of never being good at anything again. And, you don't listen to that if you haven't had a baby yet and you plan to. Okay? I didn't say that at all. That's only for the women who already have babies.
Yeah, because we're like, oh, that's kind of true.
But the thing is, if you have this baby, okay, so that the physical having the baby, whether by vaginal birth or C-section, it's difficult physically, emotionally, and then you're not sleeping, and then you're trying to breastfeed, or you're trying to choose a formula, and your child is spitting up and not sleeping, and you have these changing dynamics within your relationships, not only a marriage or partnership, but with people around you, your parents, and maybe other kids, nieces and nephews who are jealous about split attention. I mean, all this stuff is going on, and then you can't even have sex. I mean, nobody wants to go to their doctor and say, I'm not good at anything anymore, even sex. Okay. Right. So we need to just embrace this time and say, yeah, this is a time of mediocrity, but I should be able to have sex. And if I am not able to, if it's painful, I need to talk to my doctor, and if my doctor sends me to the vegetable aisle at the supermarket, I need to talk to Robyn.
Yeah, there is. Sex after birth should not be painful, with the exception, like I mentioned, I think it would be, and I'm sure a lot of the listeners agree with that, in the sense of of course, the first time might be a little okay, that was not feeling as comfortable, but it should not continue to be painful. It's never, ever, ever a secondary side effect of having children that should be sustained and just kind of dealt with. And then also in addressing it, getting professional help is just so helpful. I just think there's too many misconceptions sometimes out there about things to do if you're having painful intercourse. And so just being guided by a professional, you mentioned the vegetable aisle, and you might be talking cucumbers, I don't know, but
I was being big.
And I just
not pumpkins.
Yeah, exactly. I'm like green bean. No. But see what I mean, like pelvic PTs, we talk about this all the time. So it's not odd to me at all, when people mention stuff to me. But there are things like dilator training and things like that can certainly help, so that women feel like they're are doing something at home that they can work on. But there's other means of helping out the situation, because dilator training is not always the issue, like a tightness. So it's not necessarily always the issue. So kind of identifying and at least being able to really have a nice thorough assessment where someone can say, wow, you have tension back in the third layer of your pelvic floor, because dilator training is typically most helpful for first, second layer, really. That's what I see with my patients the most. And then sometimes if they have a lot of tension going even back into the pelvic floor further, manual therapy, teaching them things to do at home for themselves, whether it be stretching, whether it be including things to kind of what we call downgrade the nervous system. All of that is important. So sometimes a somewhat vague recommendation on, well, you don't even need to buy for example, you don't even need to buy expensive dilators, just go down the vegetable aisle. It can be a little not so great.
Yeah. Okay, so let's talk about another really common problem, and I always hate to say it because I always think I'm pronouncing it wrong. Diastasis recti.
Oh no,
Is it
that's fine.
recti?
Both. I hear
Okay.
it just depends on how people pronounce it, but it's not wrong either way. Yeah.
Okay. So a lot of times people will say they can't lose the baby weight, and that's really, yeah, we have a guest again. Hooray, hooray.
Hooray for the topic.
So a lot of times people will say they can't lose their baby weight, but actually that's not even the issue. It's that the abdominal muscles have come apart. And so it looks like maybe they're still pregnant 8,
Right.
9 months after giving birth, but that's not the end of the problem. So how do you know if you have it, and what do you do?
Identifying if you have a diastasis recti is, you can look up things online and you're going to find what they call a finger width test, which is just you're taking your own 2 fingers and you're kind of coming in the midline of the tummy, so in between the rectus muscles, and you're lying on your back and you're just doing a little head raise, and you're determining during that head raise, how many fingers can I place in that spot. So is it just 2 fingers, or is it like, wow, I can, the width of that openness in between each side of the muscle is 3, 4. Also online, thankfully, they've talked a little bit more about it's not just about the width, but also how far down do your fingers go into that space, because that tells you a lot about the connective tissue underneath. That is a fairly simple at-home assessment. What I would just say to people is really your at-home assessment should just be used to give you an idea of like, oh gosh, it's, that is what it is, or I do feel that separation. Is really, really smart to go in to a pelvic PT, somebody who specializes in DR, and really get a thorough assessment, because part of diastasis recti is also, yes, it is the width, so the rectus muscles have separated during birth. There's no way to really prevent DR truly. So they separate. That's also connective tissue separating too. So as things, as baby is born, the uterus starts to shrink back down, things come together. It is a possible muscle issue, like the underlying muscles, the deep core muscles are not strong enough, but you always have connective tissue in there too. So there's a healing component of the connective tissue going on. So that's why I say it's really good if you can get a thorough assessment, because it's not just a check of the width and the depth, but it's like, when I have people in, it's me checking, how is the transverse abdominis muscle, which is your deepest core muscle, is it firing? How is it working? And then, of course, there's so many helpful different tips beyond exercise. There's obviously exercise that you can begin to really start to use the core efficiently. But we look at your breath, because how you control and help to control intra-abdominal pressure makes a difference on the DR as well. Everything from like posture, how you tend to want to hold your baby and things like that. Can we give you some tips and tricks so that you are not stressing the area more than you really want to, while you're trying to strengthen and encourage it to close?
That's really good, good information. So I also want to talk about what's the problem with it. It's not just that you have this tummy pooch and you like it or you don't like it, or you can be neutral about it. There are other effects. There are other ways that diastasis recti can affect you.
Yes. So with the separation, if that separation of those 2 muscles stay, the abdominal component, so you got to think kind of in larger terms, your whole core from like diaphragm down to the pelvic area, can really not work optimally. Now, some people, just to kind of distinguish a little bit, just to drive home your point of, sometimes it's not just about the split, it's like, how are things working and why does that matter? There are some individuals that have textbook diastasis recti, but they're very functional. Their muscles are very strong. The connective tissue is still a bit weak, and it's not going to necessarily come back together anymore. But they have, through, correct breathing during exercises, things like that, they use appropriate strategies during running, CrossFit activities, yoga, whatever they choose to do is for movement and enjoyment, they can actually control everything nicely, and they are very functional. And then there's some people that have a DR that they're not as functional, meaning that the weakness in the core, the breathing strategies that they don't realize that they're using that are not optimal is all affecting how the core is working. And really a lot of our strength and our power in the body comes from a stable core. So if your core is not as stable, then you put yourself at risk for pelvic floor dysfunction in relation of things in the pelvic floor going wrong. You really kind of place a lot of the, how do I want to say it, kind of a lot of the strength requirements and components on different areas of your body. And that's just, we don't really want to do that. It's nice to have a strong functional core, so then the rest of the body also works off its own strength well.
It does seem like anything that happens in the body just has so many effects outward. And yeah. I think it's important for women to know about these issues. They affect us on such a big level. And if you look at the numbers of people affected by sexual dysfunction after having a baby or by diastasis recti, these are not minuscule numbers. This is very common for women to be affected. So we need to normalize this. We need to make it a comfortable thing for a woman to go to her doctor and say, this is a problem, can you help me with it? And, and conversely for the OB to say, you should see a pelvic floor specialist.
Yes. Yeah. And, I think it's improving a little bit. I mean, when I had my first baby 11 years ago, I feel like it's improved since then. I don't think we're where we need to be. I think we still have much improvement, but I think it's better. And I think sometimes, there's, even when I talk and I present facts or give professional opinions, I often try to make sure that I'm expressing this as a kind of a holistic way to look at your health as well. I don't want to fearmonger people that are pregnant or have just had babies that, I want them to think, oh my goodness, I'm going to fall apart after this baby is born. Because that's not necessarily the case, but we can't deny the very factual, somewhat obvious sometimes things that occur after birth, and just believe that our bodies don't really need addressed. It's not very practical. We've been kind of keeping women in the dark about pregnancy and postpartum for too long. There's a lot of good information to share. And if we take it in the context of being preventative and just being more aware about our own health, then hopefully we're not making anybody fearful. We're just empowering them because they're so much more knowledgeable about their bodies.
Yeah, well, that's the dream. Is there anything else you think that you'd like to cover while we are on?
There was one other thing that I wanted to talk about, and I meant to say it when we were talking about painful intercourse, but it actually applies to even like DR and just generalized healing as well. One thing that I tell women a lot that I get a response back from them of kind of like, oh, I didn't realize that, was that if you're a breastfeeding mom, a couple things happen in the body, with breastfeeding. So our hormones continue to fluctuate. And with hormone fluctuation, that actually affects connective tissue healing. So that is not a reason to stop breastfeeding. I'm an advocate for breastfeeding if the mother wants to do it and it works for the mother and things are going well. But it's just more information to kind of give yourself a little bit of grace. And again, be knowledgeable and empowered by, oh, okay, I didn't even know that went on in my body. So as you're breastfeeding, hormone fluctuation continues to occur, which can affect the connective tissue healing in your body. So you may sense and feel like, oh, I still feel kind of loosey-goosey a little bit, in the hips or the pelvis or the sacrum or the tailbone. You may find, I tell anybody that I'm seeing for diastasis recti, if they're breastfeeding, I tell them that even when they stop breastfeeding, if they're still working on, exercise, core movements, things like that, they should give themselves 4 to 5 months after stopping breastfeeding to see if they feel and recognize any additional changes in their body. They may actually get even more improvement in the DR, because as the hormones start to normalize out a little bit, then the connective tissue healing, you know, kind of kicks in again. It's healing during that time, don't get me wrong, but it doesn't heal kind of as fast or as optimal when you're breastfeeding. And then breastfeeding in relationship also to the painful intercourse, breastfeeding actually keeps our estrogen levels down a little bit. So lower estrogen levels can contribute to some vaginal dryness. So that's why I encourage people, if they're open to it, to use a lubricant with intercourse if they find it to be painful. Some people really don't get too excited about using a lubricant, which is fine. I completely understand. But if you do find that it's you feel like the pain has a lot to do with friction, it's just things aren't moving, and your partner can usually kind of tell you as well, right? They can kind of give you some insight. Using a nice clean lubricant, so no glycerin, no paraben. 3 of the top ones that I use in my clinic are Slippery Stuff, Good Clean Love, and Uber Love, I believe. They always have interesting names. And that may help for a while, right? Especially during breastfeeding, because you're at an estrogen loss. Also keep in mind that breastfeeding naturally depletes our drive or libido. So I hate to see moms kind of beat themselves up almost mentally, thinking, what's going on? Am I not as attracted to my spouse? What is going on? Breastfeeding keeps the libido a little bit low. The reasoning is because we get a lot of our oxytocin vibes and our good feelings off the breastfeeding. So our body registers that as our feel goods, I mean, of course, it's a different kind of feel good, right? But the body doesn't necessarily recognize the difference, right? So our sexual libido, if you will, or intimacy with our partner stays down sometimes. And then also, in regards to that, and there's also a very valid feeling sometimes, especially for breastfeeding moms, but just moms in general, of feeling very touched out. We've had people touching, clinging on us all day, and so that kind of keeps the libido a little low. And there will always be, I try to tell moms, if at all possible, I think we should be talking about this more. So I love that. Just be careful not to compare too much, right? Because I have talked to women that have said they can barely wait the 6 weeks to have intercourse again. I mean, they just, and they haven't, and they're like, that as well. Yeah, they're like, was that a bad thing? It was 3 weeks and I was right. And then I've had women that have said, oh my goodness, at 8 weeks, I was still like, I love you, but no thanks, and that's okay. That's okay, because our hormones fluctuate differently. There could be something going on with the mom that was ready at 3 weeks. Maybe she wasn't breastfeeding, or maybe, there could be a lot of different things. So it's always good to talk and share. Just be careful not to compare too much.
I think that's a great logical piece of advice.
Yeah. For everything, right?
Yeah, it's true. It's true, because a lot of these talks can lead to comparisons. So yeah, it's important to keep that in mind. Yeah. Well, thank you so much for joining me to talk about this really important topic, and I'm going to link to all of your information in the comments.
Okay, perfect. Thank you for sharing. I love talking to other professionals where we're all really talking about health and wellness of moms, and obviously we just have our own specialty. And in regards to your specialty, I'm sorry, I did not mention, but it is very important. Hydration and nutrition postpartum really makes a difference on your hormones too.
Yeah.
So
it's true. And I do have an infographic. It's specific to postpartum depression and anxiety and nutrition. Yes, and I can post that as well. But it's just some good reminders as well. Some of that is really geared towards nutrition for anxiety and depression, but a lot of it is just new mom stuff.
Yeah, but that's good, because anxiety and depression is another thing we probably don't talk about enough, really. And that also affects libido. So
yes, and as you mentioned, hydration can present as depression or anxiety and have an effect on your libido. So wouldn't it be nice if all your problems could be solved with a few glasses of water? So that's always the first place to start.
Yeah, more water, less wine. More water, less wine.
I'm gonna go with more water, less wine, like WHI.
Yeah. Yes, that would help too. Oh, thank you so much. I appreciate you having me on.
Yeah, thank you for joining me. So if you are a Phoenix local, you will be getting Robyn's information, and you should come to Toddler Test Kitchen, entirely unrelated to painful sex.
Except for the vegetables being served.
What was that?
Except for the vegetables, maybe. I don't, maybe.
Except for the vegetables, but we don't, yeah, we're not going to go there. So Toddler Test Kitchen is at the Farm South Mountain right now, but it's getting really hot. We're moving over to Create, which is at the Arizona Science Center, and that's a cooking class for kids ages 2 through 6, and I'm really excited about that, and we have big things coming, so come join me for that. toddlertestkitchen.net for all the dates and registration links, and anything else, babybloomnutrition.com, pinterest.com/Yaffi. You're on my Facebook now, and Naptime Nutrition is every Tuesday at 1:15 p.m. Arizona time, which is currently Eastern Daylight Time, 4:15 p.m., and Pacific Daylight Time is the same time we are, which is 1:15 p.m. So thank you so much for joining me, Robyn. It's always great to chat.
You too. Nice to see you. Thank you.
Sure. Thanks. See you next time.